Worse. Here today to talk about managing hip and knee pain is Dr. Daniel Whitmer, an orthopedic surgeon at Hartford Healthcare's Bone and Joint Institute. Doctor, welcome.
Hi, how are you?
Good. Thanks for being with us. So tell us, what are some of the most common causes and symptoms of hip pain?
Sure. So some of the most common causes of hip pain include things like arthritis in the ball and socket joint, or damage to tendons or ligaments around the hip joint itself. Some of the things that can precipitate those issues are just something as simple as overdoing it, getting out there and maybe training, running, or participating in sports without having done something in a while, without having stretched beforehand, or if you have some underlying arthritis, again, if you do a lot or walk a lot one day, your hip or knee can start to hurt.
All right. What about knee pain?
So with knee pain, similarly, the pain can come from the joint itself. Again, that's more arthritis-type pain, or when you lose cartilage in the joint, or it can come from the soft tissues around the joint, like the muscles or ligaments. Again, a variety of ways to hurt your knee, including sporting activities, falls, or trauma are something that we see a lot. In the summer, people being a lot more active, we see a lot of overuse injuries.
I'll bet you do. All right, tell us about some of the latest surgical and non-surgical treatment options at the Bone and Joint Institute.
Sure. So some of the latest treatments include minimally invasive procedures that we do, like arthroscopic surgery, to take care of some of the smaller issues around the joint. When the issues are bigger, or if they involve a lot of arthritis, we typically do joint replacement. At Bone and Joint Institute, we use a variety of techniques. We do minimally invasive surgery, we use robotics and or computer navigation, and all these techniques help our patients recover faster and easier from their joint replacement.
That's always a win, recovering faster. What can patients expect for the recovery?
So most people are back to their day-to-day activities after a joint replacement within just a few weeks. People are back to sporting activities typically in 2 to 3 months. It sort of depends on how much arthritis they had and how disabled they were prior to surgery. But patients are certainly recovering faster than ever.
That's amazing. All right, doctor, quick upcoming class on minimizing your pain. What can you tell us about it?
Sure. So the class is from 5:30 to 6:30. It's on Wednesday. It's a webinar, so it's easy to get on and review. And I'll be talking about some of these issues in depth, but also be sticking around to answer as many questions as people want to ask. So,
all right, Dr. Daniel Whitmer, thank you for the latest information.
Thanks so much.
Thank you.